So moving your head around to the right side, moving it back through center, keeping those shoulders low, looking around to the left. And repeat that a few more times, nice and fluid. Keep going through center, and each time you look behind you, see if you can look just a little bit further, just to give you a little bit of a stretch. Lovely. When you're next looking forwards, then we're just going to lift our chin gently up towards the sky, but don't crunch the back of your neck, just a nice lift, opening up the shoulders. Come back through center, and then tuck your chin in, so we've all got a lovely double chin, and look down at the floor. Get a good stretch in the back of the neck. Come back up to center, and then we're just going to roll our shoulders backwards, get us all moving, get us ready, get the blood flowing so that we can absorb all of our expert speaker information. Lovely. And then just put the hands in front of you, rotate the hands one way. Good, looks lovely. And then rotate the hands the other way. Good, shake it all off. Give everything a good old shake. Good. So hopefully a little bit warmer, a little bit jazzed up, and I will introduce you to Emma, who is the CEO of Asian Resource Centre of Croydon, and she is going to basically host us today. So thank you, Emma.
I feel warm already. I don't know about you, but I think it's always good to start with a little warm up and get the blood flowing. So welcome everyone to our second COVID-19 information and myth busting event, and the fourth in conjunction with the Croydon BME Forum and the NHS Croydon. My name's Emma Mia, and I'm the CEO of the Asian Resource Centre of Croydon. And we're an organisation that's been running for 20 years in this borough, trying to support people on the ground. And during COVID, we've accelerated our efforts to support the community. I will do my best to try and keep us on time today, but given that there are so many people in the room, do bear with us. Just to make you aware, I have to do a little bit of housekeeping. The meeting is being recorded and will be uploaded to our YouTube and website. Please turn off your video if you are uncomfortable with being recorded. Everybody is muted. As you can appreciate, with this number of people in the room, it's not possible to conduct a meeting when everybody's mic is on. You can post your comments and questions and feedback via the chat facility only. Please note that the chat facility is currently disabled. However, we will be opening that function up shortly once we've let everyone in. Please do not post any links or images, or you will be removed from the meeting. We have to ensure safety first. And just a little reminder that we are active on social media. You can follow us at ARCC Ltd on Twitter, Facebook, Instagram, and YouTube. Also, please do subscribe to our mailing list by going to our website, which is www.arccltd.com, so that you can receive information about our other events and activities. Those of you who have joined us with email this evening, you will receive the information automatically. However, you can unsubscribe at any time. I will briefly take you through the agenda for the evening. Mamoon, if you would please share the screen. Thank you. So basically, straight after my introduction, we will go to a poll. And you will be able to answer one of the poll questions, and that poll will be repeated later. And then we will go to our panel session, where we will hear initially introductions from our guest speakers, who are health specialists and doctors. And also we have a survivor case study with us. So we will be listening to Dr. Dev Malhotra. We will be listening to Dr. Ellen Schwartz. We'll be listening to Mr. Ash Balakrishnan. We will be listening to Dr. Sherifat Mohammed Kamal, and we will also be having a question and answer session from the public during our Q&A session with our panelists. This will be your opportunity to ask the questions basically from the health specialists. And then we will go back to doing another COVID vaccination poll to see if the results have changed. And then we will give you an update of some of the things that are coming up. So thanks for that, Mamin. So COVID-19 has shone a light on many different issues that exist within our society, including structural and health inequalities. However, I think we all agree that it is through collective and unified efforts, regardless of age, gender, race, religion, or disability, that we overcome and defeat this virus. Whilst hands, face, space, and replace remain the most effective way to stay safe and keep others safe currently, we now have two vaccination options that have entered the market, one from Oxford AstraZeneca, and the other is Pfizer-BioNTech. Both of them have been authorized by the Medicines and Healthcare Products Regulatory Agency, which is MHRA. For use in the United Kingdom. Sir Simon Stevens, NHS Chief Executive, wrote a letter to all of the chief executives of the NHS and Foundation Trusts, all the PCN and all GP practices on the 30th of December 2020, saying that the Joint Commission on Vaccination and Immunisation, JCVI, has not advised a preference between the Pfizer or the Oxford vaccine in any specific population, and stated that both vaccines give very high protection against severe disease and both have very good safety profiles. Now, ARCC has been working on the ground with the community throughout the pandemic and delivered services such as the food bank. We've delivered a befriending service and distributed care packs and Christmas hampers to elderly people and vulnerable people. We've also worked very closely with the NHS CCG, the council and community groups to get key communications in different languages. And now we are pleased to be partnering with NHS South West London CCG and Croydon BME Forum to bring the third in a series of COVID-19 vaccination public meetings where you get to ask the expert health panel your questions regarding the vaccine. First of all, I'd like to start with our vaccine poll. Mamoon, if you can pull up the first poll, please.
Hi, good evening, everyone. So I will launch the poll now. So the question is, would you be comfortable to take a COVID-19 vaccination? And the options are yes, no, not sure, or I have already taken it. So if you could please make your choices and submit. Just give it a few seconds. I can still see that people are still voting. Okay, so 75% of you have voted so far. Let's see if we can get close to 100%, which usually doesn't happen, but we'll give it a try.
Just to reiterate that this poll is anonymous. So if you vote, we don't know who's voted and for what.
Okay, we're 82% there. Okay, so I think I will end the poll now and share the results on screen with you all. Okay, there you go. 61% of you said yes, you would take the COVID-19 vaccination. 9% said no. 26% said not sure. And 5% said you have already taken it. So as Ima said, we'll conduct this poll at the end of the session once our panel of doctors and experts have spoken and once all your questions have been answered. And we'll see if there is any difference in people's thinking. Thank you very much.
Thanks for that, Mamoon. And I think it's always good to see if after a session, if people's minds have changed. So it'll be interesting to see what happens when we do the poll. Again, please do stick around for that. And can I initially thank you all for joining us tonight and giving up your time. It's important that we share this information with you and you get your opportunity to talk to the expert health panel, because 1 in 3 people who have COVID-19 have no symptoms and could be spreading it without realizing. We know that this is hard for many, but we must follow all the rules to stop the spread of COVID-19 and save lives. I want to do a little disclaimer that whilst our panel of health specialists are fully qualified doctors, it's highly recommended that you consult your own GP on specific concerns that you may have regarding your own individual situation. In addition to our health panelists, we will also be joined this evening by other local doctors, including Dr. Kashif Aziz, Dr. Farhana Rahman, and Dr. Uzma Aziz, who will answer questions in the chat room and also try to assist and support our panelists where they can. So moving on to our panelists, I first of all want to thank you all, and I will start with Dr. Dev Malhotra. He's the clinical lead for the mental health at Clinical Leadership CCG. His special interests are sports, exercise, and medicine. Dr. Dev also speaks Hindi, Punjabi. He also works as a Croydon GP at the Brigstock medical practice. Dr. Dev Malhotra, thank you for joining us today. Could you please speak for 5 minutes about your experience of treating COVID-19 patients, particularly in Croydon?
First of all, I want to thank you all very much for inviting me this evening. It's a real honour and a privilege for me to be doing this, especially because you support my father, and also I can see a number of patients on the call as well, and I think you do fantastic work as an organisation. I mean, it's an opportunity to share some knowledge and experiences with you all. And I appreciate that not everybody is going to be comfortable talking to their doctor about their issues and their health problems, but they may be more comfortable talking with their friends, family members, community members. And so by this way, we not only we get the messages out through those avenues as well. You kindly said in my biography that I work at the Brigstock medical practice where I'm a partner. I'm also a clinical lead for mental health for Croydon CCG, but I'm also one of the clinical directors for a PCN, and a PCN, it stands for Primary Care Network, and these are groups of GP practices throughout the country, and also obviously in Croydon, who come together and work on particular areas of health. And obviously the one that is first and foremost in our mind at the moment is the COVID vaccine and its implementation. So we are working on that. I think I don't want to step on Dr. Schwartz's toes, because I'm sure she will sort of go into this in more detail, but if anyone wants to ask me anything specific about what my PCN is doing, then I'm more than happy to share that. I've been asked to speak of my experience in treating COVID-19. So I'll try and sort of focus on that. I mean, just in terms of generally, the healthcare system has been set up to access healthcare with certain points. So from one spectrum, you have general practice, and then you have accident emergency or the hospital. But in between that, there is 111. There is the COVID clinical assessment service, and there are urgent care centres. And these are ways that you can access healthcare. In the practice, some patients with COVID-19 symptoms contact us and we assess them. But we also continue and manage all the other conditions that patients present with. With the pandemic, however, our assessment has changed. And this is largely to reduce the spread of infection within the practice to patients and also staff. Therefore, when we consult with someone, we initially speak to the patient on the phone. Patients can either communicate with us through sending photographs, we can do video consultations, they can do online assessments which go directly into their record, and the GP will contact them within the specified time frame. And also, when it's required, we will see patients face to face in the surgery, but we wear PPE, personal protective equipment, and we have to sanitize each consultation room after each consultation. If we're seeing someone with COVID-19 symptoms, we will see them in a separate area, separate from the rest of the building, rest of patients and staff, so as again to minimize the risks. We'll also do home visits. Again, we will wear PPE to do these. In terms of treating COVID, the majority of patients, I think, Ema, you alluded to, have quite mild symptoms or no symptoms at all. And we generally manage them by advising them to rest, to take things like paracetamol, drink plenty of fluids, and usually the illness settles down without any consequence. Some patients go on and develop breathing difficulties, chest infections, and we can manage them with antibiotics in primary care. When people also have breathing difficulties, there's something, a system that's come online just in the last couple of weeks, is a home COVID monitoring service. So patients with COVID who are having some difficulties, or if they're over 65, or if they've got other healthcare problems, they are provided with a pulse oximeter which measures their oxygen saturations, and they are monitored several times a day just to elicit any deterioration. If their condition deteriorates, then they are escalated to whether they need to see their GP, the urgent care centre, or even if they have to go to A&E. When people are very severely unwell, then they unfortunately need to go into hospital. The other part of the work that GPs are doing in relation to COVID-19 is a number of patients who have had it are suffering effects of long-term COVID, and they can be having breathlessness lasting several months, fatigue, pain, and we support and manage them. There's also a clinic at Croydon University Hospital where if you're suffering for more than 6 to 8 weeks, you will get support from the specialist team there. My personal experience in Thornton Heath was that during the first wave, we did see a significant number of patients with COVID, and unfortunately in those days we didn't have the test, so we suspected everyone had COVID with the symptoms of a new cough, a new onset fever, or a change in their smell or taste, and as a consequence there were a significant number of deaths. As a consequence of that, as well as the long COVID, we're also been dealing with the mental health consequences of the pandemic, which result from the actual illness, bereavement and social issues which are occurring as a consequence of the lockdowns and the restrictions, and these include financial losses, employment issues, domestic violence and other social issues. So a large proportion of my work currently is dealing with those types of scenarios. Just going to briefly touch on my work in the CCG from mental health. We are trying to transform services to make them easier to access and more supportive. Some recent initiatives are expansion of Croydon talking therapies. So if you are having some psychological issues, you can contact Croydon Talking Therapies for psychological support. You can self-refer. We've also implemented a recovery space for patients who are in crisis. And there's also an advice and guidance service for GPs to seek specialist health, because the specialists too are working under great pressures, and we can manage more in primary care. Going forwards, we plan to see the implementation of mental health support workers to bridge the gap between general practice and specialist and other services in the community. So they will support GPs to do that work. And we're looking to design a mental health hub for patients with a mental health diagnosis, where they can access support, and that can be medical support as well as social support. So to do with housing, to do with family issues, to do with finances, the things that might cause someone to go into crisis. And we're also looking to design a clinical assessment unit at Croydon University Hospital for people who may need admission to a psychiatric hospital. A&E is not the most pleasant place to be if you're in a psychiatric crisis. So this should improve the environment for them and reduce their distress. I just want to end, because I know time is pressing, but just to say that in the press, it's been said that general practice has been closed, but I want to assure you that it's been open throughout the pandemic. And we actually opened during the bank holidays at Easter and in May. And now we're a vital part of the drive to vaccinate against COVID-19 going forward. And I hope this will enable us to restore some normality to our lives. I just want to thank you again for inviting me, and I look forward to answering some of your questions and contributing to the discussion this evening. Thank you very much.
Thank you, Dr. Dev Malhotra, and I think you picked up some really important points around mental health as well, which is, you know, something that's really prevalent that we're finding within the community at the moment during COVID. So thank you for that. Can I just let you know that the chat function is now open, so you are able to post your questions only. It is a question and answer session, so we would make a plea that you keep your questions concise and for the doctors so that they can answer them effectively. Now I move on to my second panelist, who is Dr. Ellen Schwartz. Now, Dr. Schwartz is a consultant in public health at Croydon and Ealing councils. Dr. Ellen is the immunisation lead for the Association of Directors of Public Health in London. She is an eye doctor by background and worked on the eye health and prevention of blindness in Africa, India and Southeast Asia in the past. Dr. Ellen, I've heard you lots of times before. Thank you so much for joining us. And please could you speak for 5 minutes about the rollout of the COVID-19 vaccination?
Hear me now?
Yes, we can.
Excellent. So first of all, apologies, my internet connection is not great. So I've asked all the other members of the household to come off the internet. Hopefully they are very obedient today, because there are some teenagers amongst them. So first of all, thank you very much, Emma and colleagues, for inviting me. It's a great opportunity, and I would like to say in particular what you have done as the Asian Resource Centre, or are doing, is just absolutely phenomenal. This is the third event. It's so important that we keep talking, because we are all new to this. I mean, we're now 9 months into this experience, and it is so important that the conversation stays flowing, and we give people the opportunity to talk to one another. So as Emma said, I'm a public health consultant at Croydon Council, first and foremost. And what that means is my patient, so to say, is the population. So I look after Croydon's population. Before COVID, it was in various different aspects, from sexual health to immunization we've always been involved in, to mental health, to children's health. But from March, it has shrunk to probably 98% around the COVID pandemic. And I just wanted to give you a little bit of an overview what happens in Croydon right now in terms of numbers, and going back to the very, very important few sentences that Emma said at the very beginning, and just to make sure that we all appreciate what Emma said and how important this is. So this is a new virus. We don't know a lot about it, but we are learning. We are learning from the first wave. We're learning to understand how it infects people, how we can treat it. Doctors in hospitals are amazingly skilled now as compared to what was the case in March. And doctors in primary care and all health professionals are learning on a day-to-day basis. And we are actually in a much, much better position to help people should they get infected. It is a global problem, so it's not just the UK. Let's not forget that every country in this world is struggling with this, and we're kind of in this together, and we have to look outwards as well to see how others are dealing with it and supporting each other. And so many of you will have relatives and family elsewhere, such as I do. So we're all in this together. The situation has changed significantly ever since this new variant of the virus was detected. And now that viruses change is nothing unusual, because they change all the time. They change their genetic makeup to become more effective in finding a host, in infecting people or animals, because they cannot reproduce without infecting a host. So that in itself is not unusual. But this new type, this new variant is very effective. It is much more transmissible. So we're facing now a situation that there's like a wave that has gone across London and other parts of the UK, and it's kind of spreading day by day because of this improved genetic variant. And so this is why, and you've heard it last night, that the Prime Minister has talked about the lockdown. And I can't tell you, it was the first night after a number of nights that I was able to sleep, because this is absolutely necessary, that we pull the brake now, that we stop this massive transmission to carry on, and we concentrate on the rollout of the vaccine, because the vaccine is really sort of our most effective tool at the moment. Just going back to what Ima said, because actually the very most effective tool, and if people out there like me are scared, it's a normal emotion in this moment, but let's not forget that by our very own behavior, how we choose to behave, so social distancing, and now actually staying at home, washing your hands, covering your faces, to avoid transmission and infection. By our own behavior, we can actually prevent getting infected and prevent the virus from spreading. So this is the most important thing to remember. And that's why I wanted to go back to what you said, Ima, the hands, face, space words. So in Croydon, we have seen an increase of viral spread, and just in the last 7 days, we've had an incident, so that's the number of positive tests per 100,000, of just under 1,000. And that is a massive increase to the week before. And I deal on a daily basis with what we call situations. So these are cases or outbreaks in care homes in particular, in schools. Now that schools are closed, it's still rambling on in the wider school community, and also in workplaces, where we're trying to understand who's infected whom, who needs to isolate to prevent the spread from happening. And if one of you or somebody you know should get in that situation, it's really important to understand who has somebody who's infected been in contact with, and how we can support people to stay at home and self-isolate. And should that be problematic in terms of access to medicine or even financial problems or food, the council and other organizations such as the Asian Resource Center can support you, so you're not alone. Now, the push out of the vaccine is our best tool to deal with this pandemic on a global level. So we need to make sure that as many people are vaccinated as fast as possible. So this exercise is mainly driven by the NHS. It's an NHS undertaking. So we need to make sure that we're not pushing more pressure on the NHS due to other things that are avoidable, and that we're supporting the NHS in as many ways as possible. So far, the vaccination program in Croydon, and Croydon was in a lucky position to be one of the areas in London to start the vaccination program first on the 8th of December. Between 4,000 and 5,000 vaccinations have been given so far. And as you've heard, the priority at the moment is to vaccinate those people over 80 years of age, and also those people in care homes and their carers. because the primary aim, and that's how these vaccines have been tested against, is to avoid people from becoming seriously ill and from dying. And everything the government decides now, and if you look at the media today, other governments are deciding it similarly, to really spread and use the vaccine in such a way that we can vaccinate as many as possible, as fast as possible. Just one final word, I'm sure I'm nearly 5 minutes. So lost my thread there for a moment, but just one final word is this undertaking is not just for the NHS and for the UK a kind of unique exercise, but it is for everybody in this world. It is an absolutely unique and a monstrous undertaking. And we're learning as we're going along. But please, I mean, appreciate that there are many questions still to answer, but there's also a lot of hope attached to this. So we must work together, learn together, and support the NHS and our politicians, everybody, to roll us out as fast as possible. Thank you very much.
Thank you, Dr. Ellen, and thank you for giving us some very specific information, also talking about the variant. Now I'd like to move on because I'm cautious about the time and I want to get in as many questions as I possibly can tonight. We've already got so many questions coming into the chat room, and I know the doctors will be keen to answer as many as they can. And we've also got some doctors helping us out with some of the easier questions in the chat by trying to answer them there. So I'd like to introduce our next panelist, who is a COVID survivor. Ash Balakrishnan supports startups from the startup stage to corporations or scale-ups for the government. Ash also invests his time and energy into technology, property, and international trade. In his spare time, Ash organizes social events and sits on the board of the Asian Resource Centre. Ash, I want to say thank you for joining us tonight and being willing to share your story and what you went through. Could I ask you to speak for a few minutes about the experience of having COVID-19?
Well, good evening, ladies and gentlemen, my fellow Croydonians. Great to be here this evening. So as Emma said, my name's Ash. I'm born and raised in Croydon and have a massive soft spot for the area. So just to give you a little background on my experience last year. So, I've always been kind of like a happy-go-lucky guy, and I'm in my network, I'm seen as like the super connector who's always out and about, bringing people together. And when COVID was in the news, in the media, at the beginning of last year, the first quarter, I didn't really take it serious, if I'm honest. I thought it was just, I thought it was a bit of a conspiracy theory, you can say. And part of me felt that I would be immune to the disease as well. But it happened. I have light asthma. I usually go to the gym 3 to 4 times a week. So I try to keep myself quite fit. And last year, March, I started coming down with something. I thought it was just a cold. I went into May Day. It was on the last week of March, I think on a Sunday evening, got tested. And then on the Monday morning, they said to me, we're just going to put you to sleep for a couple of hours to help you with your breathing. Then I thought that I'd be in there for 48 hours max. I didn't wake up till 3 weeks later. I was in an induced coma on a ventilator. Near-death experience is a light way of putting it. So the first 3 weeks I was there, I was obviously knocked out, so I couldn't see what the disease was doing to the people around me or to me, in fact, But the next 2 weeks when I was in hospital, I was...
Ash, I'm so sorry. I think we've got a few. Yeah, the sound quality is really low. We're getting a few messages from people saying they can't hear you. So sorry to disturb your.
Is that any better?
That's much better. Thank you.
Can someone confirm it? Is that much better?
That's better.
Okay, fine. So I was just saying about the first 3 weeks when I was in hospital, being in an induced coma, you're not really aware of what's happening around you. And the second half, the remaining other 2 weeks when I was in intensive care and in a normal ward and watching the war zone You know, it was horrible. It was horrible to see the doctors and nurses coming every day, fighting, trying to save people's lives. It was like watching a nightmare. It was absolutely horrible. And so I've come out, and when I did come out, I'd lost 15 kg in weight. I couldn't walk. I couldn't go to the bathroom by myself. I was literally like being a baby again. And you know, recovery's taken longer than expected. But there was a point where I was visiting the hospital in the summer, and I was really happy to hear that the numbers in Mayday at the time was 0. And I was a bit like, well, maybe this was just a bad nightmare and it's all behind us now. And I was going to physio up until just before Christmas. I just finished a COVID rehab program, and it's actually heartbreaking to watch what's happening at the moment. It's literally like reliving this nightmare again, and I don't know how we can kind of what to say to kind of convince people that this is a serious disease, that we have to take this serious, and especially for our loved ones. You know, I haven't been able to kind of see all my friends. I was hoping that I'd have a big Christmas celebration drink with them, but that hasn't happened. And I'm probably going to skip my birthday at the end of this month as well now because of lockdown. But yeah, I mean, and now I actually have about half a dozen friends who have COVID and recovering from home, but still, it's a horrible disease, and I don't think we've seen the worst of it. But yeah, I'm trying to put the only positive spin I can put on it is that we have to use this time to reflect and kind of recharge our batteries. This time will pass. The only positive that I've got out of last year was I've actually started taking acting classes, online acting classes from home. So just as a way to kind of get out of that mental state of being in this depressive environment. But I mean, that's a little bit about my background, and I think I'm just under 5 minutes now. So happy to take any questions about it. But as I said, I think the main thing is that I wanted to kind of speak about is the fact that, you know, I'm 38, I was quite fairly fit for my age, I believe, you know, and it came and got me. So it doesn't matter about how old you are. We're not immune to this. You know, it can come and attack us in different forms, in different ways. So I guess I just want people to take it a little bit more serious, because the nurses who I've been in contact with, I visited Mayday at Christmas to give the intensive care team some food and stuff as to say a thank you for their support last year. And it's a full house. You know, it's a compared to August when the numbers were 0, we're back to pretty much having a full house in there, and it is scary. It's scary.
Thank you so much, Ash. And I know you've thank you, because I know you've cut your story down significantly to accommodate the timing of today. But really, Ash has spoken before, and we've heard the story and the gravity of the situation that Ash his family went through, he went through, is I mean, heartbreaking, really, because I just want to add a tiny bit, Ash, to what you said. I think that we were on the sort of other side as people who care, but Ash is one of our trustees, and whilst Ash was in the coma for 5 weeks, I believe, lots and lots of people praying for you, and it was really first time that we'd actually heard we'd actually heard of someone close to us that was in a coma, and I think that hit home for a lot of us, that you can be young, fit and healthy, and then have one underlying condition. In your instance, it was asthma, wasn't it? The breathing difficulties that actually led to the really, you know, the hospitalization of a young fit man. So we cannot dismiss how this disease can get you, and it is very real, especially if you're like someone like Ash, who's actually, you know, ended up in hospital.
And is it okay to kind of just mention quickly about recovery as well, and you know, the fact that it's not a case of once you're out of hospital, everything's back to being normal, hunky-dory. Last year, it took me literally 9 months to be where I am now, where I feel much better than I was. As I mentioned, I couldn't walk when I originally came out. So it's not one of those things that, once you're over it, that's it, it's back to normal and stuff. I think it does take time. But the seriousness of it is really what I wanted to kind of stress. I don't know what needs to happen for people to realize that, COVID is not a joke. This virus is not a joke. And I mean, I was lucky to have a near-death experience where it's kind of made me appreciate a lot of things in my life now. But does someone close, a friend or a family member, need to pass away for people to take this seriously? I'm a bit baffled what needs to happen. But yeah, I just want us to, it's not getting any better at the moment. The numbers are going up, and it's literally like, I'm sorry if I sound a bit stressful at the moment, but it's literally like watching this nightmare again when I was kind of hoping it was behind me.
Well, thank you so much, Ash, for sharing your story with us. Now, I know we are really pushed for time, so I'm going to quickly move on to our final panelist, Dr. Sherifat Mohammed Kamal. She's a locum senior clinical pharmacist and in the PCN. Now, she's a vice president of the PDA Pharmacist Defence Association and a part of the BAME network. Sherifat is also the vice director of BEMA, which is the British Islamic Medical Association. Sherifat was an interim head of prescribing and medicines management for Bromley Healthcare. She's also worked 10 years across different hospitals, community pharmacy and primary care trusts, and she's passionate about women, family, faith and medicines. Dr. Sherifat, thank you so much for joining us today. Could I please ask you to speak for a few minutes about the ingredients of the Pfizer and the Oxford COVID-19 vaccinations, which I think people will be really interested in understanding. Thank you.
Hello, everyone. Just to correct you, I'm a pharmacist. I'm not a doctor. Yeah. Thank you very much. I mean, thank you for organizing this, and thank you for, I feel really honored to come to this program, and I would like to really appreciate everyone that's contributed to the success of this program for the community. And I mean, going by Dr. Ellen and my previous panelists, I mean, with vaccines, the standard that we all know that vaccines has been saving lives for years and years and years. And they do this by providing immunity to foreign agents into our body system. And this same method is the same method that the production of these vaccines is based on. So looking into the consequence, the ingredients of the Pfizer vaccines, the Pfizer vaccine contains the RNA, lipids, and some salt. For some of us that are scientists, we know the way vaccines work. There are 3 different kinds of vaccines. We have the viral vaccines, we have some that are proteins, and the one that are produced from nucleic acid. So the RNA vaccines, they use the lipids to carry the lipids part of this vaccine encase the active ingredients, and the salt portion keep the pH level just very close to the body temperature. And all of this is because we wanted to keep it safe within the production unit. So that is why we find out that there's temperature variance within the different vaccines that we have. This is just to keep the active ingredient safe so that it doesn't have a higher or too much lower temperature or the pH level itself. And another thing that we need to know about the vaccine itself is the way it works. We know there's so many theories about the DNA components. We might answer the question later, but the way it works is that when the mRNA is being injected into the body, what is fun is it develops some spikes that help to produce an immune response into the body in case the infection affect the body itself. So the consequence of this, of the Pfizer vaccine itself is just to enable the immune response in the body to fight the foreign injection, foreign body itself. Thank you.
Thank you so much. Thank you so much, Sherifat, and apologies, I called you Dr. Sherifat, but I hope you won't mind. Now, we have over 200 people in the room at the moment, and lots of questions coming in. So I think it's really important now to move on to the Q&A session. And at this point, I'll hand over to my colleague, Lizzie, to introduce.
Brilliant, thank you. Thank you to all of our speakers, that's brilliant. I'm sure it's answered some of the questions, but obviously the best thing about today is that you can ask your own question. So we will alternate from questions from the chat, and there have also been questions that have already been emailed into us. So we'll alternate between both, and hopefully some of those questions that you've asked will get asked by other people as well. So our first question, and doctors, I'll just ask my colleagues to unmute you. So if you just wave your hand if you feel like you're the person that you want to answer this question. So this is regarding domiciliary care workers. So we're obviously aware there's a plan for healthcare workers to get their COVID-19 vaccine, but they wanted to have a clearer understanding of when domiciliary, so home visit care workers, will be receiving the vaccine, as there's a huge call for clients in Croydon asking and to be informed when they can have that date, when they can be vaccinated, so that they can continue their care out in the community.
I suppose somebody unmuted me. I might as well make a start. And if so, you've probably seen that the Joint Committee on Vaccination and Immunisation in the UK has come up with a long list of priority groups. And as I said earlier, so at the top are those over 80 and over 75, and also those who are either residents in care homes or those caring for the residents. And then immediately after will be other social care workers who work directly with vulnerable adults, so vulnerable people, and those will be the domiciliary care. It's really difficult, and this question I fear will come up again, and you'll get a vague answer, because it depends on how quickly can we vaccinate the top priority groups and when we then go to the next one. So we've only just started with the care home residents. The care home staff has started actually a couple of weeks earlier, but they are at the top of the priority list, where it's very difficult to put a date on, and on that day we're starting with domiciliary care.
Brilliant.
Can I come in? Just thank you, Ellen. Just to add just what's happening locally. So obviously Ellen alluded to that Croydon University Hospital are providing the vaccine for patients and healthcare staff. They are providing it to some healthcare staff, and each PCN, there are 9 PCNs in Croydon grouped to GP practices. Each one has got a designated site, and we are focusing on the over 80s. By the end of next week, there'll be coverage for pretty much 95% of Croydon practices in administering the vaccine. Obviously, as Ellen said, the priority is the over 80s and then the care homes. The practicality of administering the vaccine, the Pfizer vaccine is the one that we're getting at the moment in the next couple of weeks. We haven't got the AstraZeneca one yet. The Pfizer one has to be kept at a temperature of -70 degrees. And when it's brought to a temperature of between 2 and 8 degrees, you have to utilize that within 4 days. So what that means is you have to, practically speaking, immunize in a primary care network 300 people a day. And it may be in certain areas you may struggle to get enough 380-year-olds to do on that day, so there's vaccine left over. So what we're doing as a logistical solution is compiling lists of people who are in that sort of second group, and that would include domiciliary care workers, other healthcare professionals, dentists, optometrists, pharmacists and their staff members, so we can call them in at an early stage. But we're in the very early stages of this. Over the next few weeks, we're going to get increasing supplies of the vaccine, and this should, in theory, roll out at a pace.
Brilliant. Thank you. I'm just going to pass over to Emma because I know that she has the next person for the next question.
Thank you very much. We had this question sent in previously. So if Andrew Shippey is in the room, you can ask your own question around allergies. And if you're not, then I'll ask it on your behalf. Is Andrew Shippey in the room?
Go ahead, Andrew.
Hi, yeah, regarding allergies, it's just whether or not people have any food allergies like nut allergies, or if they have any allergies to medicines such as I'm allergic to penicillin, for example, whether that would affect them having the vaccinations.
The current guidance is that the only people who shouldn't have the vaccine are people who've had anaphylactic reactions, so severe allergic reactions where they go into shock to any of the vaccine constituents. However, if people have had unexplained allergies, anaphylaxis, to a medicine or a previous vaccine, then as of today, actually as of yesterday, they shouldn't have the Pfizer vaccine, but should wait for the AstraZeneca vaccine. But if you've had other types of allergy which are milder, such as a rash, something like that, then you can have either of the vaccines. It's only people who have had anaphylactic reactions that we need to be careful for. And when the vaccine's being administered, the history will be taken by the clinician administering before and at the time of administering the vaccine to try and highlight those potential cases.
So I've just known that I've always been allergic to penicillin, but I don't know what the reaction would be.
I mean, it wouldn't stop you having the COVID vaccine, either one.
Thank you. Okay.
Thank you. So our next question is coming from the chat. So they wanted to know, is the vaccine in the UK at any point ever going to become compulsory? And secondary to that, will there be places that can ban you if you are not vaccinated?
So at the moment, it's a clear no, it's not compulsory. We are offering the vaccine, the NHS is offering it, and in the kind of context of the new variant, the aim is to roll this out to as many people as possible, at a high proportion. But it's, I think, very clear at the moment, there's no indication that it will be compulsory. To the second part of the question, that goes back to what somebody said in the chat. So when can I move? When can I basically go around again, hug my friends after the vaccine? We don't know a lot about the vaccine yet. The vaccine has been tested against serious illness and death. We don't know whether you can actually still get infected and pass it on. So that's why, unfortunately, even if we get vaccinated, we will have to adhere to all the kind of measures that we talked about before, the social distancing, the hand washing, the face covering, as before. I hope that answers those together. Cheers.
Brilliant. Cool, thank you. And so obviously this might be more government orientated, but following on from that, could someone ask, will we need a vaccine certificate to travel to other countries? Thank you.
Dr. Ellen has clearly stated this. At the moment, this is still new to every one of us, and we're still growing and with so many information coming around to us all. So we can't say at the moment that anybody will need a certificate. And as the time comes, I think what's going to happen with traveling directions will come as well. But we know in the past, for some of us that travels to Hajj and Umrah, we have to take we have to get some certificate while we travel. But we don't know what's going to happen with COVID vaccine at the moment, but it's just being advisable. This is just happening all over the world at the moment, from one case to the other. Just advisable that we have to just know that when we need, or we're being called to take the vaccine, we should know that it's just for the benefit of our own purpose, because the risk of infection is getting higher in some region, and we don't know where we're going to be in the next couple of months or the next couple of years. and we don't know where the vaccine and the COVID-19 is taking the whole world. So it's just important that we maintain all the instructions and follow the directives as per the government instructions.
Thank you. Brilliant. So I'm just going to pass back to Emma, who I think's got our next email question.
Thank you very much. And do we have Fahad Ali in the room to ask the question around the halal and non-halal ingredients, please?
Yeah, I'd just like to ask, is there any non-halal ingredients in either of the vaccines?
Okay, yeah, there are no animal or fetal products being utilised to manufacture the vaccine.
Brilliant, well, that's easy. That's what we like.
Yes, yes.
I don't know.
I mean, I would like to just add a little bit about the British Islamic Medical Association has worked so hard on all instructions, and they've released a statement that the vaccine does not contain any ingredients in them as well.
Brilliant, thank you. So just looking through our chat questions, there's quite a lot of questions around people that have perhaps been given the shielding letter in the past, and now that we've come up to the vaccination, they haven't actually been sent a letter or anything to receive the vaccine, even though they are categorized as extremely vulnerable. So people are just wondering, you know, when will they get a letter, or is there something they should be doing? Should they be contacting anyone?
Shall I take a stab at this first? I mean, I think Dr. Schwartz alluded to earlier that the first priority group are the over 80s, because they're the most at risk of having serious illness or death. But the shielding categories are, you know, next in the tier, as well as the over 65s. And so there is going to be a rollout, and it's going to, you know, we're in the very initial phases of doing this. This has been, you know, the first vaccines have, you know, it's been like 2 or 3 weeks since they've been administered, and thousands a week are being done. And it's going to be ramped up because there are going to be more vaccination sites coming online, and there's going to be more distribution of the vaccine. And as soon as we start hitting the groups in order of priority, then GP practices or hospitals themselves will be contacting patients directly to come in for their vaccine. So I can't give you a specific answer, but we are doing this at a real pace. And, you know, colleagues have been working sort of night and day for the last, well, since the 8th of December to try and get this out when it was mooted that the first vaccine, the Pfizer vaccine, was going to be approved. So that's where we are at this moment in time. But the situation is changing and improving on a daily basis.
Brilliant, thank you. Over to you, Emma, just for email question.
Thank you very much. So do we have Charles King in the room who wanted to talk about the Pfizer and the Oxford AstraZeneca, the time gap between both of those? Are you in the room, Charles?
Yes,
or else
yes, I'm here.
Brilliant.
Yeah.
So please go ahead.
Yeah, what I wanted to say is a lot of my colleagues have had the first Pfizer injection in the last few weeks, and they've all at the moment got dates for the second injection, and they're concerned that they may not get the second injection now for several weeks. And looking at the evidence, it's not clear whether the Pfizer one can be left that time to be effective, where the Oxford one seems to be. And I just wondered if the best procedure would be those that have had the Pfizer should continue and have it within 2 or 3 weeks, and those that have the Oxford then wait to 8 to 12 weeks, whether that would be a better system and reassure people better.
Thank you very much for the question. The Chief Medical Officer and the various committees, SAGE, etc., decided at the weekend that it would be better for the population in general for the second doses to be delayed to get greater coverage. Those are the guidelines that we have to adhere to. I think when the news came out towards the end of last week, some patients were already booked in for their second vaccine, and those have been honoured and administered. But what it means is that if we go by these suggestions, that we'll get a greater proportion of the population vaccinated. My understanding is, providing you have the vaccine within that the second dose within that 12-week period, then you'll be sufficiently immunized going forwards. If it's prolonged after that vaccine, that 12-week period, then that might affect your long-term immunity. But as far as the specification goes, and basically the guidance and the rules that we've received to administer the vaccine, we have to stick with the initial dose and the repeat vaccination after 12 weeks. I don't know if my colleagues have anything to add to that.
So Charles, I think you've put your finger onto probably one of the most hotly debated points right now. And thanks also for me for that question. As I was trying to say at the beginning, in an ideal world, with a completely sort of controlled, or partially at least controlled, viral spread, we would probably take, most likely take the time and adhere to the dose as the Pfizer vaccine was tested with. But we can't afford that at the moment. We need to vaccinate as many people as we can in the shortest time possible. If that means that the vaccine is a little bit, and it doesn't seem to be that significant, less effective, that we need to kind of pay that price, but spread it out to as many people as possible. And in the end, as we said earlier, we don't know 100% yet what the kind of immune response will mean. That is something we will watch and learn every day, every week. Our knowledge will grow there. But what is important at the moment, at the second point, probably even more important than protecting the lives and the well-being of individuals, is containing the spread of that virus. And that's also why we're doing that vaccination. It is really our most valuable tool right now, but it has to be masses and fast. That's why, if you look in the media today, other countries are following the UK's example in that regard. Thank you.
Thank you. So this one's from the chat, from Amit Patel. He's asking, if one takes the flu jab, how does that affect the taking of the COVID jab? Does it increase or otherwise affect the effectiveness of the COVID vaccination?
Should I take that? They're completely different viruses, and they work on different viruses. So there's no contraindication, meaning there's no interaction between the two vaccines. I think we have a book called the Green Book, which is our vaccine schedule, which everyone in this country adheres to. So it states that you have to have 7 days apart between the two vaccines. That'll be the only thing.
Brilliant, thank you. Over to you, Emma.
Thank you, Lizzie. And is Mukesh Patel in the room at all? If Mukesh Patel, who wants to ask a question around having the choice between the two. If you're not there, I'll ask the question on your behalf.
I think you have to ask.
Okay, so basically the question is, do patients have a choice to choose from the two available? If one refuses, then do they lose their turn? There are people in the country who do like to have a choice.
The practical answer is no. We basically, each vaccine centre is getting what they're given. And at the moment, it's the Pfizer-BioNTech. There are sort of some caveats to that. So if someone's had an anaphylactic reaction to any component of the Pfizer vaccine, they can in theory have the AstraZeneca one, and so wait for that one. And the other thing that I've been sort of working on this morning is looking at care homes. With the Pfizer vaccine being so fragile, moving it around can, too much can damage the actual vaccine itself, and it may not be as potent. And so with care homes, we may opt for the AstraZeneca one because it's a bit more robust in transporting. But at the moment, in terms of choice, we're basically utilising what we're being given, and that's controlled centrally through NHS England. Ellen, did you want to add anything onto that?
No, thank you very much. I just, if I may, I know that that's kind of a bit sideways, but with some concern, I'm looking at various comments in the chat box about unpaid carers. Do you mind me commenting very briefly on that, Lizzie?
Oh, it's one of our questions we're going to bring up, so go ahead.
Sorry. Then I might as well wait.
Oh, no, go for it.
Because this is something, I don't want you to get the impression that this group of unpaid carers looking after vulnerable people at home or elsewhere are being forgotten. I'm still very heavily involved in this year's flu program. And for the first time, we had an explicit inclusion of unpaid carers, where it goes as far as you can, what we say, self-certify. That means they can walk into pharmacy, say, I'm a carer, can I have a flu vaccine? And pharmacists will give it, and there's an agreement that they should give it to them. And if that doesn't work because they look young and fit and don't meet the criteria on the face of it, they can then have a letter which the local authority gives them, and then they can get it. So they may not be explicitly listed, but they are on the radar, as are other groups like homeless people, and a long list of groups that are particularly vulnerable.
Just a question for you on that point, Ellen, is how can we escalate that? So with the flus, in GP practice on our systems, we get a code on each patient's record that they're a carer, or if they're in a particular group. How can we? I'm not aware that this is included with the COVID-19 vaccine. Can we escalate that?
I think I need to take that back to at least Pan London, to the leads of the vaccine program, probably nationally. I mean, we need to kind of come up with a robust answer in terms of priority group. Then there are after this session, definitely.
Brilliant, thank you. Always appreciate it when doctors, say, oh, we may not know, but we'll get back to you. So if anyone does want to sort of have questions answered that they may not get answered tonight, please do drop your email to the Asian Resource Centre. So I can put my email in the chat box, but you can also obviously email info@ARCC, and you can also go to our website. So please do give us your contacts so that we can then send you the answers of your specific questions. So Yvette, are you there? Because
I'm here, yes. Can you hear me?
Go ahead with your question. Yes, thank you.
Leslie. I'm vice chairman of a cancer centre in Purley, and a number of the members there, and also a number of patients, have actually asked me whether they can have the vaccination. Some of them are on immune suppressant drugs. So I'm not sure whether it's a live virus, because if you're on immune suppressant drugs, then you can't have the vaccination. So, and also I was wondering what sort of interaction there was with places like the Marsden, so that this information was being filtered through to this very vulnerable group, so they were included in the cohort of people that should be receiving vaccinations if they were able to. Thank you.
Thank you.
Shall I make a start, and I can let Ellen come in if need be, or Sherifat. It's not a live vaccine, and so it can be given to people with immunosuppression. And the Royal Marsden have got their own vaccination program, so they're administering it as well.
Okay. The reason I ask is because I know a number of people that are, having treatment there, and nobody has communicated anything with them. So that's the concern.
I can feed that back. My wife works in the Royal Marsden, so I can feed that back to her and make sure their communications are more robust.
Thank you. That's helpful. Thanks.
I suppose the only thing to add to that, hello Yvette, thanks for the question, is around communication. And I think listening to the Prime Ministerial update today, and that has been recognized, and there will be now the daily updates from the government, and I think it's absolutely necessary. When it will take a while until we go to that kind of detail in terms of the clinically vulnerable. But I think it's something that we can jointly take back to our organizations to make sure that communication is A, more frequent, B, more joined up, and goes into the detailed groups of vulnerable people. Thanks for that.
Thank you, Ellen.
Over to you, Emma, for one of our email questions.
Thank you very much. And could I ask Leila Jawada to ask her question around the second vaccine, please?
Sure. Hi. Just want to ask, how much protection do you get from the first vaccine? And also, what happens if you don't take the second vaccine? Thank you.
Sherifat, do you want to take that one?
Yes, I can take a lead on that. I just need to go back, but we're still on the developmental stage of the vaccine at the moment. And there's still so many things that we still learning of, and there's so many things that has been developed at the moment. So at the moment of time, I think we might have to get back to you on that, because we can say if you miss the first dose, you might be able to, because you can decide not to take the other one. So we're still waiting for all instructions and more developmental guidelines on those facts. Does Dr. Ellen have something to say about that? No? Yes. So we will wait and we still...
Yes, sorry, I had to be unmuted.
Okay, sorry.
So both vaccines are currently approved, have been tested against 2 doses. And we've talked about the delay, the changes to the vaccination interval. So the first dose, Leila, hello, will provide some degree of protection. And, those degrees of protection that you find in the media, sort of 95 or 87, whatever, they are then on the basis of the second dose. But essentially what we've just heard is we are still kind of learning about that. But I think there is no suggestion at the moment that we just kind of skip a second dose. It's just the current debate that Charles asked was about a delay. And the kind of, it's a debate, and where we're learning and we'll come to a conclusion and very shortly. But I don't think at the moment, any serious conversation about dropping the second dose altogether. There is also, I don't know if we've mentioned it, a little window that causes some concern because people are observing, people, for instance, testing positive after having received the vaccine. And that is also because it takes a while, up to 2-3 weeks, until immunity is established after you've received a vaccine.
Brilliant, thank you. So from our chat, we had Lisa asking, where can people find out about what's in the vaccine accurately? Especially because she seems quite concerned that there's a large amount of liquid in the bottle. So they just want to know, why is that, and where can you look it up yourself and have time to read through those ingredients?
I've got a couple of links. They're on, which I can. Is it best if I send them to you and you distribute them to them?
Yeah, so if you send them through to me, I can distribute them, but also at the end, if you could put them in the chat as well, people can copy and paste it.
Okay.
As well, that's fine. So if we do both, hopefully we'll get more people.
Sure.
Yeah, I think
Sherifat, I thought you would chip in here.
Yes, I just want to add on to here. I mean, the way the vaccine is being made, I mean, to keep the temperature, to keep the potency, and to keep the pH. That is where we have the lipid components and the salt component. So when you look, I mean, you just look basically into the way you say it. It contains so many things just to keep the potency of the active ingredients. So when we look, I mean, what we're looking might not be what we're thinking. So the way everything is being made up is just to contain and just to keep that potency in there. So the salt, we keep the pH, and the lipids try to keep the strain together so that it can encase the active ingredient itself. So that's how it is being made up.
Brilliant, thank you. Just over to you, Emma, for one of our email questions.
Thank you very much. And this is a bit more of a detailed one that I think I'll read out, and I'm not sure, it may be Sherifat to answer this one. Is there any truth behind this, that there's an accusation and the scientific plausibility with regards to the Pfizer vaccine? It's apparently a DNA recombinant. It has a patent and it changes your DNA so that it is owned by the patent owner. They will claim it will stimulate immunity and therefore fight against foreign agents. It's never been proven to be effective, as previous trials were to do with treating haemophilia, etc. And this wasn't proven to be effective either. It's basically a technology to alter your DNA and make you into whatever they want. There is the issue of efficacy, which is the performance of the treatment under ideal and controlled circumstances, which is 90% and not ideal. Then there is effectiveness, which is the performance under the real world conditions. In the real world situation, the effectiveness of the Pfizer vaccine will be much, much lower. So basically, is there any plausibility to this myth? I'd like to go to Sherifat for that first, please, if that's possible.
Yes, I think I'll take the lead on start and make a start on here. And the basic first thing that we need to know, as we say, is the COVID is just new. And it's just new. It's something that is new to every one of us. It's new globally, and we're still learning the way it's moving. We're still learning in so many things that is happening around the vaccine itself, the virus itself, really. You can see the emergence of the new strain just suddenly just come while we're still fighting to the first strain of the virus. So the question you ask is, standard vaccines, the way they work is by injecting a dead or a weakened form of the pathogen into the system, and the system will not produce the immunity to the foreign body. And this is just the basic way vaccine work. So with the Pfizer vaccine, the messenger RNA, what it does is just to provide the spikes into the system to produce the immune response. So it's not altering any DNA or altering the body or the mind or the soul. So it's the pathogen itself that is the immunity is going to attack after producing the immune response within the system. So that is the way it works. And this mechanism of action that we are using to produce, most of the vaccines, it's just a different one this time around. It's not the viral one or the protein one, but it's the nucleoside modified version of the vaccine that we're using for the Pfizer vaccine. So that's it. Does Dr. Ellen or Dev, any addition?
Just to say, just to reiterate what you've said, Sherifat, is that it's not a DNA vaccine, it's an RNA vaccine. And RNA, by my sort of basic medical school understanding, is used to produce proteins, and the vaccination targets a specific COVID-like protein called a spike protein, which when it's injected stimulates the immune system. So it won't alter your DNA, your genetic makeup, but it is utilizing another form of coding, but that coding is used to produce proteins in our body. I don't know, Ellen, you probably can answer that in far more detail, but that's
yeah, I don't think whether that's necessarily so would be so good to add any more detail. But going back to the original question, is that it doesn't introduce a virus, and it definitely doesn't introduce a live virus. There are other vaccines that do that, and they're still very efficacious. So I think you've covered everything. We can, of course, forward some more specific information, documents, if people would be interested. I just wanted to add one sentence that I should have said at the very beginning of what I said. And that, Sherifat, you said it, I think you mentioned it. Vaccinations have been around for quite a long time. In terms of public health, there are two things that have made the world kind of a safer place. One is water and sanitation, and one is vaccinations. They've proven very, very effective and safe.
Thank you so much, all of you, for that one. Just to highlight to everyone that Dr. Deb has put in some links for what's in the vaccines in the chat. So if you go through and scroll through the chat, you can copy and paste those so you can have a look at your own time later. So a really simple question, but probably complicated answer. How effective are the vaccines against the new variant?
So maybe I can make a start.
Yeah.
So at the moment, as I said before, the viruses mutate, they change their shape and their genetic makeup all the time. Mostly, a little bit. And this one has changed quite significantly on various points, both outside and within the virus as it kind of appears. At the moment, it appears as if the vaccines are actually efficacious. They work to protect against that vaccine. We don't know whether there will be further mutations of this specific variant or even completely different variants. And that's yet another reason why we need to push this out as quickly as possible. Together with the lockdown, which you now heard how I feel about it, is really something that controls the spread, and should do, and we can all help to do that. But there's another added kind of argument for saying, let's get this out and support the NHS to get it out as quickly as possible.
Brilliant, thank you. Over to you, Emma, for one of your questions from email.
Thank you very much. And it's Dilly Cerulio in the room. You have a question around the vaccination programme in Croydon and over 75s, please.
Yes, thank you, Emma. I was checking on what stage has this vaccination program reached for the 80s, and when will the 75-year-olds start on it? I've got two questions, actually. One is that. The other one is, I'm a front-facing worker for Croydon Council, registering births and deaths, and I think we come under key workers as well. We don't know when we will be vaccinated, and how do I go about it?
Thank you very much for your question. I'll have a stab at this first. I think I've sort of mentioned previously the current situation with the vaccination program. So there are centres at Croydon University Hospital. There are 3 up and running in PCNs in Croydon, primary care networks. The other PCNs will be up and running by the end of next week. We're taking each of the groups in turn, and that begins with the over 80s. And then once we've we've vaccinated the over 80s, then we'll move on to the over 75s and the other groups, and it will be the sort of health and social care staff. I don't know the answer to your second question, if that comes under that designation, but at some point, you know, we will be vaccinating and contacting people to have their vaccinations done, but it's done in order of priority, because the people most at risk are the older generation, the over 80s. The average age of a death from COVID is 82. So that's the group that's being targeted first. But I just have to reiterate, we are in the early stage of this, but we are moving at a terrific rate to try and cover as many of the at-risk groups as possible.
Brilliant, thank you. I just wanted to say that obviously everyone's probably noticed it's 7:30 and there are a lot of questions around this. So I just wanted to pass to you, Emma, to see if you wanted to do the poll, and then maybe we could very cheekily ask the doctors and the pharmacist if we could stay for a little bit longer for a few more questions, but we'll get the poll in now because people may need to leave.
Yeah. I think let's do that, because we said the programme would end at 7:30, and that was really ambitious, and I want to thank you, doctors, already for your time, and if you will give us a few more moments, we have lots and lots of questions coming through, which I know we won't be able to cover all today, but if we could just have a few more minutes afterwards. But Mamoon, can I ask you to do the second poll so that people who are here can at least get that answered? Thank you.
Yeah, sure. So the poll is exactly identical as the first poll. So I will launch the poll now. If you could kindly make your selections and submit. So the question is, would you be comfortable to take a COVID-19 vaccination? Yes, no, not sure, or I have already taken it. And just to remind everyone, at the beginning, when you conducted this poll, 61% of you said yes, 9% said no, 26% said not sure, and 5% said that you had already taken it. So we'll see if there has been any change now that you've heard doctors and some of your questions being answered. Okay, so it's been a minute now, so I will end the poll and share the results with you. Okay, so there we go. The results are on the screen. 63% of you said yes, 8% said no, 23% said not sure, and 7% said that you had already taken it. So I don't think there has been much change in the results from the first one.
What's the not sure? What's the shift in the not sure, Moen?
So not sure was 26% in the first one, and now it's 23%.
So people have become more decisive either way, and the shift, it looks like, has gone towards the positive, because we have 2% more people, and I think that's going in the right direction. So thank you, doctors. It looks like the information that you're giving out is shifting people towards taking the vaccination. Can I ask the doctors, are you happy to continue answering questions for a few more minutes?
Yes. Yeah.
Thank you very much. And for the guests here, I know we said we'd finish at 7:30. If you can bear with us, and there are some really interesting questions to be answered, yes. And we will try not to carry on for too much longer, given that it's an evening meeting. So Lizzie, back to you.
No problem. Deborah, are you there? Because you had a question that we've been asked a lot, actually.
Yes, a lot of young people say to me who are in the teens going to school, they have information that this COVID-19 vaccine causes infertility among young people. Is that true?
Thank you very much for the question, but a simple answer is not that we know of. No, I don't. I mean, obviously there is no long-term data, but it's been tested on about tens of thousands of people before it's been launched. The other thing is not being offered to under 16s as far as I understand. But the reality is it's highly unlikely to, but there's there's no sort of long-term data for this, but if you look at other vaccines, they don't generally have long-term side effects or adverse reactions, and so we would presume that this would be the same.
And the thing is, we don't even know whether this vaccine we have to take every year or once in a lifetime. We may have to take it every year as well.
Like,
Can we just add something? Yeah, Dev, you go ahead.
No, carry on. I was going to reiterate what you just said. But
So it's really important that we're hearing about those concerns, and we see the same concerns actually almost identical to what you've said about the flu vaccination in particular, where people are always very concerned, and other vaccinations. But as Dr. Malhotra just explained, vaccinations are effective and they're safe. There are side effects. There are people who act allergically. There are local, and I've seen in the chat people was talking about the local effects, which often you have to also consider that show that there is an immune response. They're not surprising. They're actually not a bad sign. But there is now a significant experience over millions and millions of people with various vaccines, and they are safe and effective. Unfortunately, there's a lot of misinformation, one has to say, around. With this one, as we said, it's different because it's new, but the principles and the rigorous quality assurance and safety testing is exactly the same as for other vaccinations. So we can rely on the system, and these are global checks, that the vaccines are checked and then approved in all the countries. We've seen that all the countries where the European approval system or the United States approval system went through checks and deemed those vaccines safe.
Thank you. So obviously we've had hundreds from the chat, but one that's come up a few times is there any sort of contraindication for taking the vaccine if you're on antidepressants, and does the vaccine itself create issues for people with depression?
Thank you for that. There are no known contraindications if you're taking antidepressants, and it's not one of the common side effects to induce a change in your mental state. The common side effects tend to be a bit of a local reaction, potentially a sore arm. Some people may complain of a bit of headache or a bit of a flu-like illness or fatigue, and very rarely allergy. Those are the recognised side effects and complications of the vaccine. But as far as we're aware, and like alluding to the previous answer, with millions and millions of vaccines being given around the world, they're generally very, very safe and have been thoroughly tested before they've been administered.
Lovely. All right, so I think we've got one more question and we'll let everyone go. So Emma, I think you've got the next question, or the next person.
Thank you. There's a question from Nasser Ali. Are you in the room to ask your question?
Yes, I am.
Thank you.
Good evening to everyone. Thanks, Emma, and Mamoon and ARCC for hosting this sort of event. Thanks to the doctors for taking the parts. And on behalf of British Bangladesh Society, I'm necessarily like to ask a question. How soon after the vaccination that I can go out mix with other people?
Maybe I can just start by repeating. First of all, thank you for that question. I thought I picked that up in the chat line earlier as well. The thing with the immunity, the protection that is established from the vaccine, is that the aim of the vaccine is initially to protect you from getting seriously ill or actually dying. We don't know whether the vaccine will actually prevent you from harboring the virus or transmitting it. Therefore, even if you're vaccinated, you will need to adhere to the same infection prevention and control measures that are currently in place. And that is the social distancing, the hand washing, the mouth covering, and obviously now the lockdown. So if you mean mingling and kind of hugging people, I'm afraid we're still a little bit away from that, unless these are people in your household.
Brilliant. Thank you. Thank you. You guys did brilliant. You made it through to the last one. But anyone that is still left, please just remember that you can send us emails, because I am in constant contact with our doctors, because they're so generous with their time. So we can get some specific questions answered, but obviously not immediately. They are extremely busy, as I'm sure you can understand. So Imra, I don't know if you just want to close up and say thank you to everyone.
Thank you very much indeed. And thank you, doctors, again, for your time. And you've done this voluntarily for the public good. And thank you, Lizzie, for the amount of work you've put into this. Thank you to all my staff, in fact. A lot goes into these meetings when we have them. And thank you to everybody who attended tonight and sent in your questions. We haven't been able to get through all the questions. We've got 50, 60 questions left that we could, carry on all night with, but we won't have time. So we will endeavour to try and do another session. I just want to remind you that we do have a virtual coffee morning coming up for mental health and social isolation support. Right at the beginning, Dr. Deb Malhotra mentioned the mental health effects. So we are trying to, as a community group, do as much as we can to support people on the ground. So if you can attend our virtual coffee morning, that would be absolutely brilliant. It'll be a really nice question and answer session and information giving as well. The other thing I wanted to mention just before we go is that we've all heard today how important it is to get vaccinated and how much effort that the NHS is putting into making sure that everything is done well. If transport is a problem, we know that there's numerous reasons why people might not want to get vaccinated, but if transport is a problem, don't let that be a reason for you not to get the vaccine, as there may be some help and support available get to your local vaccination hub. If you get in touch with us, we may be able to signpost you and give you some support there. If you have any further questions or queries, please visit reliable and safe sites. Remember, you can always ask your own doctor as well. We've got some recommended sites that you could visit. So one is the World Health Organization, and that's www.who.int. And then there's also the NHS's site, of course, which is www.nhs.uk/conditions/coronavirus COVID-19. And then there's the government's website, which is www.gov.uk/coronavirus. Get your updates from a known source that is reputable, like the government and the NHS and WHO, rather than from sites that may not be credible or may not be verified. On that note, I want to wish you all the best and say stay safe, and thank you for joining us. Until next time, see you later.